I'm Dr. Rita McGuire. I'm the Chief Medical Officer for Wakana, one of the co-founders, and I represent the pillar of health. I'm an obstetrician gynecologist. I've been practicing for over 30 years, and yes, I'm still working in the operating room, doing hysterectomies and C-sections and tummy tucks and liposuctions. But 3 years ago, I was introduced to CBD by our CEO, Melissa Boston. And I tell you, never did I ever think that I would even be asked to testify for the legalization and taxation of adult use cannabis here in Illinois. So I'm very immersed in the industry. I'm doing a lot of work with not only medical marijuana patients, but certifying patients for our opioid exchange program, but absolutely have been using CBD, what we're going to be talking about this evening, in my practice for the last 3 years. So tonight, we are going to talk about and discuss sickle cell anemia and the benefits of CBD. I want to first let you know that I am dedicating this webinar to my father, who is the late Richard R. McGuire Sr. He's pictured here with Martin Luther King Jr. My father had sickle cell trait. I'm also dedicating this webinar tonight for my nephew, Richard Carl McGuire, who passed away just in August. He also had sickle C disease, which is a variant of sickle cell disease. So these two great men who I love and so grateful and honored, we are dedicating this webinar to them. So what is sickle cell anemia? Sickle cell anemia is a disorder. It is a genetic disorder that affects the red blood cells. And what happens is that it causes the cells to become very rigid, sticky. They become crescent, or what we call sickled shape. And when these cells become sickled, they get stuck. They get stuck in the blood vessels. The shape prevents them from carrying adequate oxygen throughout the body. In fact, sickle cell disease affects over 100,000 Americans. So you can see on the right where the normal red blood cells are a nice round disc shape, but those who have sickle cell anemia or sickle cell trait or any of the variants like sickle C, they have the sickling, and it causes the cells to get stuck in blood vessels and really cause a lot of problems, and we'll talk about those tonight. So here is a way that you can look at the genetic predisposition of a family that can be affected with sickle cell anemia, sickle cell trait, sickle C, and even the thalassemias that we talk about. We see in the instance of my father, who had the trait, and my mother, who was normal, had my brother, my oldest brother, who had the trait, and then passed it on to his son, my nephew, Ricky C. There's a lot of variations where there are families that the entire family, all of the children, would have sickle cell anemia if both parents have sickle cell anemia. We even look at the father and the mother who both may have a trait, and 1 out of every 4 children will have sickle cell anemia. So you can see the genetic predisposition can occur in different variations versus mom and dad being trait or stricken with sickle cell disease. So again, there are many variations of sickle cell anemia. In the instance of my father, who had sickle cell trait, he didn't find out that he had the trait until I was a young girl and we went to Colorado skiing. What happens is that when the cells don't get enough oxygen, they become sickle, and then they become an issue with oxygenation. So each time we went to Colorado skiing, or every time we went to Mexico for Christmas, my father would get violently ill. And it wasn't until he was in his 50s when a doctor said, you know what, we need to test you, is when he found out that he had the trait. Again, sickle cell anemia, they typically have sickling that occurs at oxygen levels that are quite different from someone who has the trait versus even someone that has sickle C disease like my nephew, or even sickle beta thalassemia. Normally though, sickle cell anemia is diagnosed shortly after birth. It primarily affects people of the sub-Saharan African descent and descents of Spanish-speaking countries in the Western Hemisphere. Approximately 1 in 12 African Americans carry the sickle cell gene. The gene can be passed on, as we saw in that diagram, to their babies if both parents have the sickle cell gene. But in the majority of cases, there is no cure for sickle cell anemia. There are treatments, but there is typically no cure for sickle cell anemia. So let's look at the cells again. A normal red blood cell looks like a very round disc or cup. The sickle cells, as you can see, they have a very distinctive shape. They're sickled and they get, again, stuck in blood vessels. Some of the symptoms that sickle cell anemia causes is anemia. That means there's a shortage of red blood cells that results in a lack of oxygen, and therefore you see many times these patients are very fatigued and they lack energy. Another big symptom of sickle cell anemia is pain crisis. The episodes called crisis are a hallmark symptom of sickle cell anemia. These patients come into the ER, they're in a lot of pain. Many physicians may think that they're drug seeking, but they absolutely have a lot of pain due to the sickling of the cells. There's swelling of the feet and hands. Again, this is caused by a lack of blood flow. There's frequent infections. Why? Because those sickle cells can damage the spleen. We know that our spleen is important in fighting infections. So it really leaves them more prone to many infections. We see in infants and young children that have sickle cell anemia have a delayed growth. They have a delayed growth because, again, their red blood cell count is low. Even vision is affected. It's possible that these tiny blood vessels even become an issue and block the vessels in the eye, which cause retinal damage and even blindness. So again, when we look at a typical blood vessel and we look at how a sickled cell gets stuck and it gets blocked, it can cause a lot of issues in the heart. It can cause issues in the lungs, in the brain, in the liver, in the gallbladder, in the eye, in the skin, in every single organ. Sickle cell anemia can be a problem. We see in small children something called dactylitis. Dactylitis is painful swelling of the hands and feet. It's truly a very, very complicated syndrome that needs a lot of attention in small children. It involves helping to reduce the swelling. That involves fluid restrictions, sometimes pain medications, and even these children have a lot of fever, which can cause a medical emergency. Sickle cell anemic patients can also be affected by the sickling and lack of blood flow in the gums, causing a lot of infection, periodontal disease, in the tongue area, in the jaw area. Wherever blood flow is needed, those are issues with sickle cell patients. This is a picture of a retina, of an eye of a patient who has sickle cell retinopathy. What that means is that, again, these blood vessels that are trying to nourish the eye, the retina, become sickled, lack of oxygen. So we see a lot of visual impairment and even blindness. So sickle cell anemia is very much like diabetes, right? It can affect every single organ in the body. Now, this is a complication, unfortunately, that caused the demise of my nephew. It's called acute chest syndrome. This is when the cells become sickled in the lung fields. They become acutely short of breath. And because of that, they have a lot of issues, and it can cause even venous thromboembolisms. That is blood clots that occur in the lungs and can cause a fatality. So the pulmonary complications are very common in sickle cell patients. We even see the sickling of blood cells that block blood flow to the bones. So there's issues with necrosis. There's issues with bone growth that we see in young children. And then we talk about the spleen. Again, those cells that become sickle, you see the normal size of a spleen is small, but when they become sickle, the spleen starts to enlarge. And as it enlarges, its function is decreased. So the spleen, again, is important in fighting off infections, and that's why sickle cell anemic patients typically have a lot of infections, because their spleen is not working in its optimum to fight off infections. Even the skin is infected with those who have sickle cell anemia. The skin can be infected with bacterial infections. You can see here this patient has a very severe ulcer that causes a lot of issues. We look at the liver. The liver is affected. The gallbladder is affected. Why? Again, the blood flow of the sickled cells not only decrease oxygen, but they get stuck in these very important organs and cause these organs to have a lot of dysfunction. And then we have something called priapism. Priapism, again, is a very, very common issue in some men who have sickle cell anemia. Why? Because the blood flow is compromised because of those sickled cells decrease oxygenation to very vital organs like our reproductive organs. Priapism starts out in the opposite of erectile dysfunction. It is a prolonged erection, and after so long, because of the inability of those blood cells to get through, they start to then cause erectile dysfunction and even issues in the bedroom. So we see the libido is decreased because there is a dysfunction in the penis, and also an issue with women as well who have sickle cell anemia. So some of the treatments that we traditionally use in the hospital for those patients is absolutely antibiotics, because most sickle cell anemic patients have a crisis many times because their immune system is very inadequate and they are prone to infections like pneumonia. So we use antibiotics for that. Hydroxyurea is another medication that we use because hydroxyurea is used to reduce the need of a blood transfusion. But unfortunately, hydroxyurea can increase the risk of infections, and it may cause tumors or leukemia. So a big side effect to this medication, so you don't want to use that if you don't have to. Pain relievers. Now, pain relievers is one of the reasons why we see this opioid epidemic. Patients with pain crisis with sickle cell typically need morphine, they typically need Vicodin, they absolutely need more stronger pain medication than over-the-counter pain relievers. Blood transfusions are also needed. We need to replace those sickle blood cells with normal blood cells. So with blood transfusions, yes, we test the blood in the hospitals, but many times those patients are at risk of contracting hepatitis and HIV. We use statins. Statins is a medication that we typically use to lower cholesterol. But statins are used in those patients with sickle cell anemia because it may help increase the blood flow through the blood vessels. Nitric oxide is a gas that helps keep the blood vessels open. It reduces the stickiness of the blood cells. So nitric oxide is found to be in low levels in those who have sickle cell anemia. Assessing for stroke risk is very important because sickle cell anemic patients are at risk for strokes, they're at risk for aneurysms, they're at risk for thromboembolic events like DVTs in the legs and pulmonary embolisms in the lungs. And then again, another treatment that we absolutely use immediately when those patients come in the hospital is oxygen, helping to improve the blood flow by giving them oxygen. So far, the only potential cure for sickle cell anemia, besides genetic modification, is a bone marrow transplant. But donors are really hard to find, and transplants involve some serious risks, including death. So those are the typical standard treatments that we give our sickle cell patients. So let's talk about how cannabis, CBD, can be an option for those patients who have sickle cell trait, sickle cell anemia, or even like my nephew, sickle C disease. So cannabis has two species. One species is the hemp species. That species contains a higher level of CBD, 20% or more, and contains less than 0.3% of THC. The other species that cannabis has is the marijuana species. And this is a difference that you on the webinar need to understand, that the species that is marijuana contains a very low level of CBD and contains more than 20% of THC. And we'll talk about what those things mean. So CBD is an abbreviation for cannabidiol. And cannabidiol, as you can see in this slide, has a long list of medicinal properties and benefits to the body. We talked about how sickle cell anemic patients are prone to infection. They're prone to infection because the spleen, which help fight off infections, has now been compromised by these sickled cells. So CBD is a very powerful antibacterial. CBD also reduces the function in the immune system. So what that means is it reduces the inflammation, it improves how the immune system works, so it improves the health of those with sickle cell. CBD also reduces inflammation. It helps to reduce pain. It's a very powerful analgesic. It helps to slow bacterial growth. And again, bacterial growth is one of the risk factors that actually causes patients to go into pain crisis. So when you reduce the ability of a bacterial infection occurring, or reduce the fact that you can give someone who has sickle cell crisis, maybe they may have 10 a month, when you can reduce that number by using CBD and not using opioids, we truly have a product that can help those patients. CBD also reduces the risk of arterial blockage. And we talked about the fact that when those cells become sickled, then they start to block the arteries that are leading to the heart, that are leading to the lungs, that are leading to the eyes, that are leading to the penis, that are leading to the spleen. All of these properties will help improve the symptoms of those with sickle cell anemia. When we look at the other cannabinoids that the plant makes, like delta-9 THC and CBG and CBC, when we talk about that whole plant, we then look at a full spectrum product. And we're going to talk about our full spectrum products tonight, but I want you to understand that CBD or cannabidiol is the non-psychoactive cannabinoid. It is the cannabinoid that gives you the health without the high. It is found in large concentrations in the hemp plant, as well as in the cannabis plant, but we're going to talk about CBD being extracted from the hemp plant tonight. Now, THC, or delta-9 tetrahydrocannabinol, is considered the psychoactive cannabinoid. That's a part of the compound that gives you the high. It gives you the high when you consume THC. So when you combine THC and CBD, what I love about that is that CBD actually negates the high that THC gives. Again, CBD antagonizes the effect of THC. It delays the onset of high, but it's the CBD that has the long list of medicinal health properties without the high. So how does CBD work? Well, there is something called the endocannabinoid system. And guess what? Every single human being and animal has an endocannabinoid system. This system is the most vital regulatory system in our body. In fact, it was discovered in the early 1990s when I was in medical school, but they didn't teach us anything about this system. Think of this system like a lock and key effect. When the cannabinoids come in as a key, they will hit the receptors to open up the receptors to put our body into balance. And you can see on the far right side, there are receptors that are looking for THC and CBD and CBN and CBG and the other cannabinoids throughout our entire body. Every organ and gland has receptors on the cell surface that are looking for cannabinoids. There are receptors in the eyes, in the lungs, in the liver, in the kidney, in the bowel, in the skin, in the stomach, in the teeth, in the heart, in the brain. And what's so interesting is that we talked about every single symptom and disease entity of sickle cell anemia that can affect every organ in our body. From sickle cell retinopathy, from pulmonary hypertension, to issues of the liver and gallbladder, the kidneys, the bowel, the skin ulcers, the stomach, the teeth, the periodontal disease, the heart, the aneurysms, the venous thrombosis that can cause not only a clot in the leg, but it can lead to the lung and the heart, and even strokes in these patients. So you can see how CBD can be very helpful in those who have sickle cell anemia and have symptoms that affect every single organ and gland in the body. Again, this slide may be a little blurry, but you can see there are receptors in the spleen. There's receptors in the reproductive organs like the penis, the ovary, the testicles. There are receptors in the bone. There's receptors in the immune system. Again, these receptors are looking for CBD to put the body back in balance, to decrease bacterial infections, to help decrease pain crisis, to help decrease the blood flow that is now constricted from these cells being sickled. So you can see how the endocannabinoid system plays a major part in those who have sickle cell anemia. The endocannabinoid system plays a major role in a lot of physiological processes, in our appetite, in our digestion, in our metabolism, in our cardiovascular function, in inflammation, pain, regulation of stress. I'm telling you, and those who have sickle cell anemia and they continue to go to the ER and pain crisis, you best can believe there's a high level of anxiety and even depression because their quality of life has been diminished. Their sleep-wake cycles. Insomnia is a big issue with those who have sickle cell anemia. It's hard to sleep when you're in a lot of pain. So let's look at how CBD may relieve symptoms of sickle cell anemia. Well, we talked about how CBD interacts with our endocannabinoid system. Our endocannabinoid system helps to regulate and modulate a lot of physiological functions that we talked about, including our response to pain. So taking in CBD can help eliminate inflammation and it can reduce pain. So we can take someone who has sickle cell anemia or sickle cell trait or even sickle cell disease and decrease their inflammation, reduce their pain, so they're not on all of these opioids. Again, sickle cell anemia, patients have trouble falling asleep. Why? Because of their pain and anxiety. We know that CBD has anxiolytic properties. It has properties to make you feel calm, to help you feel less stress. These properties are because CBD acts on receptors in the serotonin and the dopamine pathways of our brain. This helps us sleep, it helps to reduce anxiety, and it improves the overall quality of life of those with sickle cell anemia. Early studies and anecdotal evidence support patients to supplement with CBD because it absolutely can be beneficial in several ways for those who have this disorder. How safe is CBD to take when you have sickle cell anemia or sickle cell trait or sickle cell disease? Well, according to the World Health Organization, a report that was stated in 2017, CBD is considered safe, it's well tolerated, and it isn't associated with any abuse potential. Why? Because CBD, cannabidiol, gives you the health without the high. Compared to most prescription drugs like Vicodin and morphine and Percocet and methadone, these are prescription drugs that we give our patients that have sickle cell pain crisis. CBD has far few side effects, and guess what? There have been 0 deaths related to cannabis. So we see about 130 people who overdose and die on opioids every day. So CBD absolutely is a very safe and effective way of treating pain for those who have sickle cell crisis. So it's important, again, that if you are on medication, that you talk to your physician, you consult your physician and let them know that you want to take CBD to help reduce the symptoms of your sickle cell anemia, your sickle cell traits, and even your sickle cell disease. So let's get into our product line here at Wakana, but a little bit about our company. Our company was launched on April 20th of 2019, and our company name is Wakana. And Wakana was brought into existence through the synergistic efforts and shared foundational values of 4 African American women who believe that health, wealth, legacy, and freedom are gifts that belong to all people. Here are the 4 co-founders. Our CEO, Melissa Boston, brings to us 29 years of home-based business, as well as 15 years in the industry of sales. She retired at the age of 32 and a half years old from corporate America. She has been MVP of 6 of the 5 corporate America jobs that she's held. She's an author. She is a powerhouse. She has trained over 50,000 distributors in over 40 countries. She is our visionary and she is leading Wakana. Our president, Dr. Patricia Van Pelt, is a state senator serving her 3rd term here in Illinois. She's also an entrepreneur and truly brings the pathway to ownership here at Wakana. And our senior VP of sales, fabulous Phyllis Nash, we call her our midwife, where she has birthed so many possibilities and truly is the powerhouse of sales and training here at Wakana. Her background is that she's been an entrepreneur all of her life. She has taken Leon Barbecue back in the day to put it on the map. She was a cashier and ended up running every Leon Barbecue in Chicago. She's also been in real estate as well as transportation companies. Myself, Dr. Rita McGuire, I'm Chief Medical Officer. I bring 30 years of experience as an obstetrician gynecologist, but truly have been in the space of cannabis for the last 3 years, as all 4 of us have been. So let's talk about our products, because you know there's CBD products everywhere. When the Farm Bill of 2018 passed, you saw CBD and still see CBD at gas stations, at smoke shops, at beauty shops, at barber shops, just everywhere. But those products are not products you can trust. Our products are very unique. Our company is very unique because we provide some of the most rich medicinal hemp that is fully compliant with the State Department of Agriculture regulations. Our products are industrial hemp registered, and our products are Farm Bill compliant. The 2018 U.S. Farm Bill allows hemp to no longer be a controlled substance. For 80 years, hemp was considered a Schedule I drug. It was right up there with heroin and cocaine and LSD, but the 2018 Farm Bill descheduled hemp, and now hemp and its derivatives are legal in all 50 states. On a federal level, it is legal to sell, consume, and even cultivate and grow hemp. Now, hemp is defined as containing 0.3% or less of THC. And that's really important that you understand that the legal limit of THC is 0.3, and that CBD has to come from hemp and not marijuana. So here is our product line. We have an amazing product line. We have a power line that you see on the left. The power line is our full spectrum line. We talked about full spectrum, right? The synergy of all those cannabinoids that we saw, like CBD and CBN and CBG and Delta-9 THC, along with the terpenes. The terpenes are what gives the plant its aroma. It gives that plant its musty, woody, kind of skunky smell. They also have medicinal properties, and those are the products in the black label. Our pure products are our broad spectrum products. Those are the products that contain less than 0.0% of THC, and those are the products that those who have random drug screens are going to take so that they will be in compliant with their job. So we're going to go over our product line. The FDA does not approve of these statements. So if you are nursing, pregnant, under a physician's care, if you're on medications, please consult with your physicians. We are not allowed to make any diagnosis or to, make any claims that our products cure. So please consult with your physician before starting CBD if you are under a physician's care. So our power line starts with our hempranium. Our products have a proprietary formulation. See, our products are very unique. You're not going to find a CBD product out there that is also enhanced with USDA certified organic essential oils. This product has black seed, turmeric, and peppermint. If you know anything about black seed again has powerful antibacterial properties. In fact, hospitals are now using black seed to address methicillin-resistant Staph aureus, which is another deadly bacterial infection that many sickle cell anemic patients have to deal with. This product is a tincture. That means it's an oil that you place underneath your tongue. Very easy dosing, starting with 3 drops in the morning and 3 drops in the evening. What will this help someone who has sickle cell anemia? Well, this will reduce their incidence of bacterial infection. It could help reduce their pain crisis. It can also help reduce their anxiety, their insomnia, their depression. So many powerful products that can help those with sickle cell. Our next product is our Power Water Soluble. This is a great product that is a full spectrum product that can be used in your beverage and in your food. So those with sickle cell anemia that may not want to hold the oil underneath the tongue may want to infuse their water, their smoothie, their food. Very easy. And then our Culinary Plus is a great product for those who want to bake and cook with our CBD oil. Again, when you're baking and cooking, make sure that you're baking and cooking below 350 degrees, because when you get higher than that, you can cause the CBD and its benefits to be just heated away. And you want to maintain not only the terpenes, but you don't want to have a bitter taste if you overheat when you're cooking. So these are our amazing power tinctures, water solubles, and our Culinary Plus. Our next power products are our vape oil cartridges and our pre-rolls. This is a great way for someone who has sickle cell anemia and has an acute pain crisis, or has an acute anxiety or acute depression that comes on. When you vape, the onset of action is within 1 to 5 minutes. 1 to 3 pulls is all you need on the vape oil cartridges and our pre-rolls. Our vape oil cartridges, again, come in a raspberry jane, which is a nice flavor, or our hypnotic will have the additional proprietary formulation of black seed and turmeric as well. So again, another method of ingestion for those who have sickle cell crisis or frequent acute crisis, that these products can work very quickly. Our other products that we talk about are our Power Mango Body Cream. We talked about how in sickle cell anemia, they also are affected with skin infections, with skin disorders. This body cream will give you 500 milligrams of CBD to address those issues, as well as we talked about priapism. We talked about the libido issues. We talked about erectile dysfunction. We talked about how the reproductive tract can be affected in those with sickle cell anemia because of the sickled cells and the decrease in blood flow. This product, CBD lube, can be placed on the penis. It can be placed outside of the vagina for those receptors that are found in the reproductive organ, and can help those who have sexual dysfunction because of their sickle cell anemia. Now, our Power Gummies. These are a great way to ingest CBD. It's 25 milligrams of CBD in each gummy. These gummies also help with all of the same benefits that we talked about that CBD offers the body, in decreasing anxiety, insomnia, libido, inflammation, pain. One gummy is a great thing to take at night so that those with sickle cell anemia can decrease the inflammation, to help them sleep, to reduce anxiety, and they can wake up refreshed, full of energy, because they've gotten that restorative sleep. We have topical products at Wakana. I love our topical products because our topical products can offer local relief to those who are having pain due to sickle cell anemia. This product is a 200 milligram concentration of CBD. It also contains some amazing organic, certified USDA essential oils that address inflammation. Black seed, arnica, peppermint, menthol crystals, eucalyptus, clove. So many powerful essential oils are added synergistically with the CBD to offer relief. We have another Power Relief product, 500 milligrams. Now this is in a larger container, so this is not as potent as the first product, but absolutely is a great way to offer local relief to those who have mild to moderate pain crisis due to sickle cell. Let's move on to our pure products. Our pure products, again, are our broad spectrum products. That means they contain less than 0.0% THC. But what I love about our formulation is that we use a delivery method called nanotechnology. See, nanotechnology allows for the CBD molecule to become more water soluble. By becoming more water soluble, the nanotechnology causes the bioavailability, the ability of the cells to be addressed to 98.7%. So the bioavailability is very high. Our products come in a tincture, as you see here, as well as we have gummies that again are a broad spectrum product, a great product that those who have random drug screens can use if they have issues and symptoms due to sickle cell anemia. On Black Friday, we introduced some amazing new products. We introduced empowered hair. We introduced a culinary oil, a vegan butter, a grass-fed butter, and another topical liquid relief. Again, all of these products contain 0.3% or less of THC. They are broad spectrum products. Again, that can be used by those who have symptoms due to sickle cell disease. They can put it on their toast. Instead of using olive oil, you can use our culinary oil. And absolutely those who have issues with thinning or alopecia due to sickle cell anemia, again, the blood flow even to the scalp can be compromised in those patients. So our empowered hair will address that hair thinning and produce more healthier hair. So our, again, empowered hair is 100 milligrams of CBD. It's loaded with so many organic USDA essential oils that include black seed and baobab and borage and pumpkin seed and lavender, cedarwood. All of these essential oils improve the blood flow in the scalp. Again, in sickle cell anemia, we have issues with blood flow. Even our Power Liquid Relief, we call it our Dr. Rita's Rub. See, Dr. Rita's Rub has 20 USDA certified organic essential oils along with 200 milligrams of CBD that will absolutely offer fast relief when used topically. I love this oil. Again, it will help some of these patients who have sickle cell disease to decrease the amount of opioids and other harmful medications that they must take. We also have spices. Can you imagine using these spices on foods and really helping to address, again, all of the benefits that CBD has on symptoms that those with sickle cell disease have to face each and every day? The quality of their life can be improved by you sharing these products with those patients and those people, with those loved ones. We have a chili lime, a garlic fire, and a flavor king. We have, again, the grass-fed butter, the vegan butter, and our culinary oils, because we understand that the edible market is hot. Everyone wants to infuse their food, enhance their food. They want the health without the high in their food. So there's several different ways that you can get started on our products. And I want you to make sure that you call the person that invited you on the line, because that person really loves you. There's a way to get our products at a wholesale price through our personal dispensary. That's a 40% discount you get a combination of our tinctures, our culinary plus, our water solubles, our relief topicals, our vapes, and our gummies. A great way to save. Your cost is $299, and we give you $500 value in that personal use dispensary. It's a great way to use these products for your personal use, to share them with loved ones that you know may have sickle cell disease, sickle cell trait, sickle C disease, as my nephew, to help decrease pain, decrease anxiety, to help them sleep, just to improve their overall health and wellness. And then our other dispensaries are full crown jewel dispensary. This is a full dispensary that includes an opportunity for you even to share this business opportunity with others. The cost is $998, but guess what? It's a $2,000 value where it's a 50% profit margin, where you can start the products, you can start sharing these products with other people, and you can even retail these products with other people. This product line comes with a full business tool opportunity, and we'll talk about that more on our Tuesday night call, but just know this is our #1 seller, which is our full crown jewel dispensary. So I want to thank you for joining me this evening and talking about how sickle cell anemia and the benefits of CBD can absolutely help those symptoms that many of those patients and loved ones suffer from. I want you to contact the person that invited you on the line. We want to get these products out to you. We want to improve your overall health. We want to decrease those symptoms. We understand that we can't make any claims about curing or making diagnosis, but we do know from the literature and all of the research that CBD, being a very powerful analgesic, helping with pain, decreasing inflammation, improving anxiety and depression, helping those sleep, improving the blood flow in the eye, in the liver, in the lung, in the heart, in the brain. All of these studies we know can make a huge impact on those who suffer from sickle cell anemia. Here is another slide that if you want more information, a lot of my information was taken from this article as well as many other articles. And again, thank you for joining me on this webinar. Again, I want you to contact the person who invited you tonight on this line, and we want to make sure that we get your questions answered and we get your products ordered. Have a good night. We are looking forward to next Wednesday. You know, I've seen a lot of people come into the ER with gallstones and needing gallbladder surgery. You may know some of those people. Next week, we're going to be talking about the benefits of CBD and gallbladder disease. Have an amazing night. And again, thank you for tuning in.